In this video, I'm going to talk about foot care advices and foot examination advices for diabetics. Diabetics, with their neuropathy, get their feet numb. When your feet are numb, you can't feel the damages and injuries happen to your feet. You have to observe, examine your feet daily to get to know what's happening in your feet. Very important to check your feet daily. So let us see what are the prerequisites for this foot examination. To prepare for the examination, first you have to dedicate a fixed time slot every day for this activity. You have to use a diary and jot down all the details of your findings. You have to compare each day with the previous day and how it has been during the previous week. It's always advisable to wash your feet with lukewarm water before the examination. And once you have cleaned your feet, you better dry your feet on a white cotton cloth. Any stain on that white cotton cloth can be a telltale sign of a potential damage. You have to set up a well-lit place, and if you cannot examine your foot by yourself, you have to use a mirror or you can ask for help. So this is the model I propose for foot examination. I suggest to break down your foot into 5 sectors. First is the ankle area. Second is the midfoot, and third is the forefoot. The fourth sector is in between the toes. And the fifth one are your toenails. And let us see what we have to examine for. You have to look for any cracks, wounds, blisters, pustules, bruises, and any other types of injury. And ultimately, you have to check the temperature of your feet and compare it with the same spot in the other foot. If there's any difference, it's alarming. And in the fourth sector, in between the toes, you have to check for fungal growth, cracks, any discharging signs. And in toenails, you have to squeeze them a little and see whether there is pus or any other fluid coming out, whether the nails are avulsed, whether there's fungal growth on nails, and the general condition of the nails, as well as whether the nails are properly cut. And once you have done all this, what's next? After the foot examination, you have to decide whether to meet the doctor or not. Then any problem, any injury, any suspicion, you have to meet your doctor as soon as possible, because any small injury can lead to an amputation within about 72 hours in diabetes. And you have to cut the nails properly and moisturize the foot and the dorsum and up to the knee with maybe baby cream or Vaseline, or if nothing is available, you can even use coconut oil. Never put oils or creams in between the toes. You can use talc powder to keep it dry. And you have to examine your footwear for any foreign material that can cause damage, and you have to choose the correct footwear as well. And cutting the nails properly and examining your footwear and how to choose the correct footwear for your diabetic feet will be discussed in the next video. Thank you.